And welcome back. I'm Mabel Jong. This is day 2 of the World Healthcare Congress in Washington, D.C. In our studio right now is John Kane. Dr. John Kane is Senior VP for Behavioral Health Services at Northwell Health. Thank you for being here, Dr. Kane.
My pleasure.
Now, you just finished a panel. What were some of the key takeaways that you can share with us?
Sure. So the panel focused on what we call collaborative care and or integrative care. And the idea is, how can we bring together primary care and behavioral health services in a seamless and integrated fashion so that those people who are struggling with both medical illness and psychiatric illness or addictive disorders can receive the kind of comprehensive care that they need. And our feeling is that these behavioral health problems are often not getting the attention that they deserve. We need to create better models so that care can be truly integrated.
What can a better model look like?
Well, some of it has to do with reimbursement. And so until we have sort of capitated agreements or risk models or alternative payment models, there's not necessarily the right incentives to provide integrative care. So some of the services may not be billable, et cetera, et cetera. And I think what we've seen in the past is there are different silos. There's money set aside to pay for medical conditions, and there's money set aside to pay for psychiatric or addictive conditions. We really need to have these integrated because we want to be able to treat the whole person. We understand that these illnesses can influence each other in a variety of ways and result in tremendous increases in cost overall.
Are you hopeful that we're going to get there?
Well, I think the progress has been slower than we would have liked, but I think we are making progress. I think there are some very good models for integrative or collaborative care that have shown to be effective and shown to be cost saving. So now it's just a question of having the sort of the will and incentives to implement these programs on a broad scale.
What do you think is attributing to a slowness in getting to where we need to be on that front?
Well, I think we need more sort of healthcare reform. We need more understanding and better communication between the different disciplines, so primary care and behavioral health. We need to make sure that we're training practitioners so that they can apply this model in a cost-effective way. We also should take advantage of technology, whether it's telemedicine or smartphones or other applications that can help us engage people and retain them in treatment, provide the services they need. We also have to overcome the stigma, I think, that still plays a role, and we have to improve what we call mental health literacy so that the public, but even some of our colleagues in general medicine, need to have a better understanding of what mental illness really means.
Okay. What are the key takeaways you'd like to leave with our attendees in terms of the way forward?
I think the way forward is going to depend upon, better education of all of those involved, creating the right incentives and the right revenue streams to ensure that we can save money at the same time providing better outcomes, better patient satisfaction. I think that's possible. It's just a question of really working to achieve those goals.
Okay. And Dr. Kane, may I ask, why is this event on your calendar this year?
Well, I think this is a very important mission, so to speak. I mean, I think many of us believe very firmly that we have to be as proactive as possible in trying to facilitate better integrative, collaborative care, and so that's part of our mission.
Okay. Dr. Kane, thank you so much.
My pleasure. Thank you.
And I'm Mabel Jong. Thank you for watching. More content to come.